Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Tara Narula. First up, this coming Tuesday is Rare Disease Day, meant to raise awareness of these often serious medical conditions. Observation of the day began in Europe in 2008, and a year later the event started to be marked in the U.S.
Rare diseases in the U.S. are defined as those that affect fewer than 200,000 people. Estimates by the National Center for Advancing Translational Sciences show an estimated 25 million Americans are affected by rare diseases. There are over 6,500 different types, and fewer than 5% actually have treatments. So, John, I think what might surprise folks is that some of the diseases and conditions that are called rare are actually sort of well known. What do we mean when we say rare diseases?
For example, cystic fibrosis, Huntington's disease, the muscular dystrophies, ALS, which is also called Lou Gehrig's disease. So, the people who have them, they feel isolated because they're not one of these diseases that has so many people that a ton of money has been poured into it. And it's really a problem. About half of cancers are considered rare, too.
Wow.
The theme of the day this year, Tara, is research. What are the challenges researchers face?
Well, Anthony, research really holds the key to giving hope to these patients, as John mentioned, who feel isolated, frustrated, and confused at having no answers. Answers to what do I have? What is my prognosis, and is there a cure? But the problem is there are challenges. So you're trying to put together trials of a group of patients that is very small in many cases, and diagnosing these patients is small. So, of course, studying them is going to be very difficult. In addition, there's a geographical spread. So patients and scientific experts may be located in different parts of the world, different parts of the country. In addition, there is a perceived high risk of failure. So if I invest in research studies, it's unlikely that I'm going to find a treatment or a cure. Do I really want to do that? And then there is a lack of natural history studies where we really follow patients, a group of patients with a condition over a period of time.
John, how is the government taking steps to address this?
Well, the NIH, the National Institutes of Health, is all over this. And if there was ever a reason to understand why you have to support basic research, it's this. Because the approach has been, you have all these different disparate types of rare cancers, but maybe they share underlying metabolic defects, problems within the cell. If we can study the inside of the cell and figure out how cells normally work, then when they go wrong, when they go kaflooey, maybe we can figure out treatments. And that's exactly what they're doing. There's something called the Orphan Drug Act that was passed in 1983 to kind of help speed along development of new treatments for rare diseases. And since then, more than 575 new types of treatments have been developed. In the past year alone, the very first drug for Duchenne's muscular dystrophy was developed, and there have been also some other treatments in the last year. So the punchline here is, when you're thinking about cutting research funding, think about the fact that what they're discovering today may help cure a rare disease or some other disease for a loved one in 10 years.
Yeah, there's some encouraging news in there, too. I didn't know kaflooey was a medical term.
Scientific.
So learned that in medical school. Third year.
You learn all sorts of stuff in Morning Rounds. Next up, healthy eating for children. Parents and caregivers all strive to keep their children fit and healthy. And what a child eats is a big part of that. This week, a new national poll was published by the University of Michigan C.S. Mott Children's Hospital. Over 1,500 parents were surveyed on their views and their strategies for providing a healthy diet for their children. Nearly 100% of the parents agreed eating habits during childhood do have a lifelong impact on kids' health. However, only 34% were confident they were doing a good job shaping those habits. Sarah, let's start with this whole concept of whether the parents surveyed felt their child were getting a healthy diet.
Yeah, the answer is most of them did not. And this is a huge struggle for me. I'm a cardiologist. I'm a mother. I teach my child to read the nutrition facts, and it is still hard. So in this survey, they found that only 17% of parents felt that their children were eating very healthy. 56% said mostly healthy, and 27% said somewhat or not so healthy.
So, John, do most parents understand what types of factors lead to healthy eating?
They actually do, but maybe surprisingly, 21% thought it was either only somewhat important or not important to limit junk food or fast food. And that same, about 16% had a similar sentiment for sugary drinks. And I think, one of the problems is that you have to almost brainwash kids into thinking, well, the fruits and vegetables are fun. And there was a chef who told me once that in the 60s, it kind of got goofed up because everybody kind of thought of health food as, steamed broccoli and alfalfa sprouts and ugh. But now, the drive now, the movement is to show kids you can cook, it's delicious, grow your own gardens, pick things, eat them off the vine, and I think that's kind of the way to go. Make them think it's fun to eat well.
Eat certain things off the vine.
Not everything off the vine, right? Not the fermented grapes.
Yeah, right. Finally, mosquitoes. The insects are known and feared for their ability to spread disease. All over the world, vaccines are used to target specific mosquito-borne viruses. But a new vaccine takes a different approach. The National Institute of Allergy and Infectious Diseases has launched a clinical trial for an investigational vaccine called AGSV. The goal is to provide wide protection against a number of mosquito-transmitted diseases, such as Zika and West Nile virus, by triggering a response not to a particular virus, but to the mosquito's own saliva. Tara, this seems like a great sort of innovative approach here.
It's huge. We just don't think about the threat, the public health threat that mosquitoes pose. So to be able to knock out several diseases at once with a vaccine would be a really big advance.
Boom, boom, boom.
And I was in communication with Tony Fauci, Dr. Fauci, head of infectious diseases for the NIH, and he said it could be potentially a universal vaccine. Early stages,
Wow.
but imagine a treatment like that for malaria.
Yeah, focus on the method of transmission rather than the virus
Absolutely.
itself. All right, Doctors Jon LaPook and Narula, good to see you guys.